I want to be a pharmacist because I want to be able to help patients in the way that's most helpful, and I think one of the most helpful ways you can help people is to help avoid pain and help cure ailments and things like that. So I was working in a clinic in Hawaii, and there's this patient that came in and he said his medication wasn't working and he kept having high blood glucose values, and this is a problem because it could result in a future hospitalization. His doctor tried to help the problem by increasing the dose for his medication, but he still said it wasn't working because he had bad values still. And so the pharmacist at the clinic asked him to show us how he uses his medication. And so he took off the cover of his insulin pen and he started to try to inject it in his belly, and he said it was leaking. And we saw it start to leak, but what happened was he didn't take the second cover off for his insulin, so the medication never entered his body and could never help him with his diabetes. And it's a good thing that we caught this early on, because if he continued to have these high blood glucose values, then he could have ended up having very negative health outcomes. And it's a good thing that our pharmacist asked him this. Pharmacists should be recognized as healthcare providers because everyone should be able to have access to this kind of healthcare. The kind of healthcare that our patient with diabetes had, where we could look over his medication, see that everything's going right, and that he could have the most optimal patient outcomes and patient care because of the pharmacist's role in checking to make sure patients have good medications that are working for them.